I think we can all go home now. Thank you.
Sorry about that. Sorry. Now let's hear reinforcement.
See what I can add to that with my particular expertise. And one of the things I liked today was we all learned live long and prosper, right? And if you're not prospering in the current system, quote unquote, you really do have a problem. And my work representing people who aren't prospering in this system is maybe the hardest for a personality like mine, which is a idealistic pessimist. And that's a big problem as I listen to all these wonderful ideas about how to properly care for people in the community. And I will mirror the themes that we've heard. We're all getting older, like mega older, like tsunami older, right? We're living longer with the illnesses, injuries, and disabilities we were either born with or developed over our lifetimes. People want to set their own goals and priorities. I thought the use of the word priorities today was even better than goals. My mom was ill last year. Her priority was to be able to go to and maybe dance at my niece's wedding this August. May seem small, but actually, could she have done that? That would have been mobility and family time and motivating the physical therapy, which was painful. So I thought that notion of what's the patient's priorities was particularly well placed, and I think it's woefully backbenched. As I say, I've represented Medicare beneficiaries for 30 years. I don't think I've ever heard when I spoke with the people I was trying to get services from, well, what does Mrs. or Mr. want? Do as much as you can in the community. And we want to talk about, one of the themes was we're not just talking about the person's home, but the community as a whole. And as you also just mentioned, I would also say transportation, housing, those things really didn't come up, but those are very big issues. And I was delighted to hear of something as creative as handyman as being part of a plan. Again, the Medicare world in which I work is so siloed that staying home may not be possible because I can't figure out how to have this low-income person get a bar on the bathtub and a ramp up the stair in her, makes me weep, 40-year residence, been there for 40 years. Coordinate care. Coordinate care, coordinate care. We all believe in coordinated care, but I fear, and as I have to say, heard about Medicare Advantage as a model, that I must warn that coordinated care means to coordinate the care, coordinate the services, the transportation, the housing, the physicians, the handyman, not manage the dollars, save the dollars. And I know this is controversial, but follow the money, that's what we do. And it's created a huge set of problems for all but the highest income people with the illnesses, injuries, disabilities that they attain during life or were born with. And I always say to people, plan as if you may get injured and you will get ill. And I think that is the way people should plan and have a community that will help them. We want to be focused on the individual and think about what the person's priorities are, and also how does that person, this was something that wasn't mentioned, but yes, a willing and available caregiver, and also a willing and available patient, if you will. I had someone call me the other day who said, well, they couldn't provide the home care. I said, well, why? I mean, I can get the Medicare coverage. You do that part. I'll do my part. And they said, well, he refused the service. Well, the evaluation was supposed to be, hi, how are you? I'd like to watch you pee. That was their notion of how they were going to evaluate. That's what he heard. Someone was going to come into his house who he hadn't met, and see how he ambulated to the bathroom and went to the bathroom. Now, I can visualize all that as a professional, as a way to identify whether there are throw rugs and whether there's a ramp in the right place, all the things. But how you communicate is incredibly important. So yeah, and also mothers don't necessarily want daughters to attend to their bathrooming needs, and we need to recognize that and accept that in terms of what does this patient, because we talked a lot about this individual focus, and I think that is so, so important. We talked a lot about technology, and everybody, I think, is rightly focusing on what can this mean. But as we're talking about that, and as we were throwing ice water on our heads this summer, which raised wonderful hundreds of millions of dollars for ALS, we have been struggling at the Center for Medicare Advocacy with denial after denial after denial of durable medical equipment, prosthetic devices, and speech-generating devices, which our Medicare no longer wants to pay for if they also let you text and email, only if they will allow me to talk to you. And so we need to make sure that we organize, support one another in making sure that, yes, the payment systems are in place to really do all these creative things that we know need to be done and are needed by the people. Also, while I was here, I learned that Mrs. Jimmo herself, who has been denied again Medicare coverage for her home health care and is blind and has an amputated leg due to her diabetes and lives in rural Vermont, cannot get her home care because she can't afford it. If she can't get the home care, I can't appeal that Medicare denial. And yet Medicare's home care benefit can be a wonderful opportunity for people if we'll stop believing that it's an acute care benefit only. Under the law, I need you all to know it's got no duration of time limitation. And with much, much respect for the presentation by Ms. McCann from Interim, if we're leaving a patient, her last, one of her slides said, we leave the patient at the end of the episode still with the disease in place and aging, the disability is still not gone and still taking multiple medications. Please recognize, you caregivers, that may still need the skilled care that only you can provide, and that maintenance services are coverable by Medicare. So all in all, the themes that I take away is we need a 21st century Medicare program to work with, and that we need to be courageous enough to insist that we do what this patient needs and what this patient can handle in his or her community and get the community around. And I hope that from this, we can have some sort of a electronic mailing list that might try and move as a multidisciplinary across the country group of people with varied expertise to make sure that we can follow the money to true coordinate home and community-based care for our generation. Thank you very much.